and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Gastro, and today's video is a very common and interesting one, so let's get started. So in today's video, we'll explore the question, what are 10 causes behind your nagging back pain? So the back is a complicated structure of bones, joints, ligaments, and muscles. One can easily sprain ligaments, strain muscles, rupture discs, and irritate joints, all of which can lead to severe back pain. While sports injuries or accidents are the usual culprits of terrible back pain, sometimes the simplest of movements, such as picking up a pencil from the floor or lifting a heavy object, can have very painful results. In addition to this, arthritis, poor posture, obesity, and psychological stress can also go on to cause or complicate back pain. Experts estimate that up to 80% of the population will experience back pain at some point in their lives. Back pain can affect people of all ages, from adolescents to the elderly, and is the third most common reason for visits to the doctor's office, behind skin disorders and osteoarthritis or joint disorders. Statistics show that worldwide, back pain is the single leading cause of disability, preventing many people from engaging in work as well as other everyday activities. So here are 10 causes behind your nagging back pain. Number 1 is muscle or ligament strain. So a back muscle strain occurs when fibers in a back muscle begins to tear from being overstretched or overused. In a similar way, a ligament strain of the back occurs when ligaments in the back are overstretched or torn. Ligaments are the tough, fibrous tissues that connect bones together. So heavy lifting at the gym or stressful repeated motions, such as in sports like rowing or golf, can all essentially lead to a back muscle or ligament strain. Number 2 is bulging or ruptured discs. So herniated discs, also called ruptured discs or slip discs, occur when the soft tissue of a spinal disc pushes through a crack in the tougher exterior casing. And although the entire disc does not rupture or slip, the small area of the crack will go on to irritate nearby nerves and result in intense pain. Most patients complain of pain that radiates from their lower back area down one or both legs and sometimes into their feet, which is called sciatica. Number 3 is degenerative disc disease. So degenerative disc disease refers to symptoms of back or neck pain caused by the wear and tear on the spinal discs. So our spinal discs are like a system of shock absorbers between our vertebrae in our spine, and they help our back stay flexible so that we can bend and twist easily. But as we get older, these discs begin to tire and degenerate, which causes an intense pain in our back. Number 4 is poor posture. So sitting in a slouched or in a hunched position, especially over a work desk, can put tons of strain on the discs in our back, which are the fluid-filled cushions that protect the vertebrae from rubbing together. Not only does slouching affect our spinal discs, but it also forces us to overwork the muscles in our neck and back, which all lead to stiffness and terrible pain in our neck, shoulder, and backs. Number 5 is being overweight. So extra weight equals extra stress on our spine and joints. Individuals who are overweight or obese have lumps of excess belly fat, which eventually causes their pelvis and lower back to slant a bit forward. This creates a permanent and round arch in their back, which causes them extreme back pain. Number 6 is scoliosis. So scoliosis is the development of a sideways curvature in your spine, and it affects around 2 to 3% of the general population and most commonly occurs in teenagers. Back pain is usually the first sign to develop in scoliosis patients, followed by back stiffness, numbness, cramping, and a shooting pain usually in the legs from any pinched nerves in the back. Number 7 are kidney stones. So kidney stones are traditionally known to cause very severe back pain, which usually occurs when the stone begins its journey down into the ureters. This severe pain is called renal colic and is usually deeper and higher up in the back. The kidneys are located underneath our rib cage on each side of the spine, and pain from the kidneys can be felt on either side of the middle to upper back, most often under the ribs to the right or left of the spine. Number 8 is Ankylosing Spondylitis. So ankylosing spondylitis is a form of arthritis that primarily affects the individual's spine. It causes a severe inflammation of the vertebra, which usually leads to chronic pain, stiffness, and disability of the spine. In more advanced cases, the chronic inflammatory process causes new bone to form in the spine, which are called bony protuberances, which also leads to deformity of the spine and further pain and discomfort. Number 9 are spinal or vertebral fractures. So broken bones of the spine or fractures of the vertebrae can vary widely in their severity. Some fractures are very serious injuries that result from high-energy trauma and require quick and prompt emergency treatment. Yet other fractures can be the result of lower impact events, such as a minor fall in older patients whose bones were already weakened by osteoporosis. Most spinal fractures occur in the thoracic or mid-back region and lumbar spine, which is the lower back region, or in the connection of the two, the thoracolumbar junction region. The typical aspect of pain in a fracture of the thoracic or lumbar spine is usually moderate to severe, which is also worsened with movement. If the spinal cord or nerves are also involved, these individuals may also experience bowel and bladder dysfunction, along with numbness, tingling, or weakness in their limbs. And finally, number 10, which is psychological stress. So though it may seem hard to believe, mental or emotional distress may be the reason you're experiencing your intense back pain. When we're stressed, our breathing patterns change and cause strain and tension in our mid-back regions. Our shoulders hunch up and cause pain throughout our upper and middle back, and the lower half of our back muscles tense up, causing lower back pain, which includes a deep pain in the tailbone region. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new update. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the 10 causes behind your nagging back pain.